stroke-related deaths are projected to rise among millennials as they get older.
He finds controlling 3 risk factors lowers the risk of a severe stroke. The author said the results emphasize the importance of managing stroke risk factors.
Today we're going to be talking about something which is incredibly important for the well-being of Indians and for people all over the planet. And I brought none other than one of our own experts, Dr. Dileep Yavagal, who is a clinical professor of neurology and neurosurgery and the director of interventional neurology and the co-director of neuroendovascular surgery at the University of Miami in Jackson. Welcome to the channel, Dr. Yavagal, and thank you so much for joining us. You know, we're looking at a future where Indians and Americans and global citizens are afflicted with non-communicable diseases. And part of that disease burden is strokes. So what is a stroke?
The word was coined long time back to indicate how a patient presents when they have a stroke, which is they have a sudden change. And that's why it was called stroke. But really, it is due to a blood vessel problem in the brain that occurs pretty suddenly. It can be of 2 main types. One is, as you pointed out, an ischemic stroke, which is due to a sudden blockage of the blood vessel in the brain, one of the blood vessels, and that's the most common type. Okay. And so that's 85% of all strokes are ischemic.
Okay.
And then 15% are bleeding type of strokes where the blood vessel opens up or ruptures and causes bleeding in the brain. So those are really, that is exactly what a stroke is. And the main thing is that this injury to the brain leads to paralysis most of the time. And that disables the patient.
So what are the signs and symptoms? So if I was having a stroke, what were the things that someone should look at?
So the best way to remember the signs and symptoms of stroke, which are easy to miss because they can be confused for different things. But if they are recognized with this acronym, then you can spot a stroke. And the acronym is called BEFAST.
BEFAST. That's BEFAST.
That's correct.
Okay.
That's correct. And the letters stand for the following. Any sudden onset, and the key word is sudden, of balance loss. B stands for balance loss. So you're fine and you suddenly lose balance. That could be a sign of stroke. Any sudden eye difficulties, like vision difficulties. So E stands for eyes. You suddenly lose vision in one eye. Suddenly the vision becomes double. And then F is sudden face drooping. So if you see somebody where their face suddenly starts to droop, that is F for face. And then A is for arm weakness. So if somebody is, holding a cup and they suddenly drop it and they suddenly, slump to one side, that's arm weakness is a sign of stroke if it happens suddenly. And then S is for speech. So if somebody's speaking and they go, they either slur or they lose their words, that is a sign of stroke. And T actually stands for time to call emergency.
Okay.
And so that's not a symptom, but rather a action to do. So BEFAST is a very well-validated, tested and proven acronym to remember.
This is so important because if you just remember the BEFAST acronym and you put it on your phone and you give it to caregivers as well as put it in public spaces, early recognition is one of the keys to diagnosing a stroke. And when we talk about early recognition, we're talking about a witnessed stroke, because oftentimes what ends up happening is you come home, someone's not behaving right, you don't know the time to onset or the time when this started. And we'll talk about why that's important in a second. Before we go there, though, we've talked about what is a stroke, what types of strokes there are, and what are the symptoms. What's the incidence? How often are we seeing this now in India and globally?
That's a really great question. Unfortunately, we are seeing it way too commonly. In India, it's estimated that every 40 seconds there is a stroke happening in the country. And obviously, given the huge population, that is something that is very concerning. But the numbers are as follows: a total of 30 to 40 lakh strokes occur in India every year, which is a huge number. And stroke is the fourth leading cause of death and disability in India. And this is long-term disability, where a person in their 50s, 60s, 70s is either bedridden or wheelchair bound for a long time, and also can cause death, but death is actually less common, and long-term disability is the more common outcome with stroke.
So it's a huge incidence. It's not a small thing. And probably even more so, they estimated that more people would die of non-communicable diseases by 2023. Along came the pandemic and it wiped that out. But we're getting to the point where lifestyle and acquired diseases are becoming, more of an issue, infectious diseases. And in India, I think we need to recognize that. Now, we've talked about the symptoms, we've talked about the incidence. Tell me something about what you're seeing in terms of now you've got a diagnosis or someone's witnessed it. And let's frame that for a second as we move from a nuclear family to a more divided family. And it's not one India, it's 28 states, 8 union territories comprised of 30% metro, 70% rural. And even now, people are going to work, and husbands and wives are both working. And so oftentimes the older folks are there. How often are strokes recognized in time?
That's a really great question, and unfortunately, not often enough. In fact, they are confused, as I said earlier, for someone being sleepy or, just grandpa is a little tired, or in younger people, it can be confused for drug or alcohol overdose because somebody's slurring their speech. Oh, that person may be drunk, or in the US, the opioid crisis really led to a lot of suspicion of somebody having been on drugs when they were actually having a stroke. And so the bigger cause, though, is that there is just a total lack of knowledge of BEFAST, and the witnessing person is often just perplexed and puzzled and not doesn't know what to do because the person doesn't appear to be in distress. Like when somebody's having chest pain or somebody's having breathing difficulty like asthma.
Right.
So when the person doesn't look distressed and they just look a little altered, a lot of times the common reaction is to let the person sort of just rest.
Yeah.
And calm down or something like that, which delays care.
Okay. And just so we frame it properly, what are the risk factors I should think about? Because that kind of frames the argument that if you are 10, 20 years old and you're having these symptoms, I wouldn't really think about a stroke. But if you're in the age of 40, 50, 60 with some of these risk factors, which you're going to talk about, then that adds to the likelihood of this being a stroke. So what are the risk factors for stroke?
Yeah, the risk factors for stroke are age, like you just mentioned, older age, and unfortunately in India and low and middle income countries, that age is younger by almost a decade, even a decade and a half.
Wow.
So people in their 50s or even right after 45 in India can be at risk for stroke, but every decade that risk almost doubles.
Okay.
So age is a risk factor. The other risk factors are as follows: high blood pressure, one
Yep.
of the most important and common risk factors. Diabetes is a very, very important risk
And
factor.
we happen to be a class one kind of um, epicenter of diabetes and heart disease, as you know.
Yeah, absolutely. The other big risk factor is irregular heartbeat or atrial fibrillation, which in India is often in younger people due to rheumatic heart disease that
Ah,
causes
interesting.
atrial fibrillation.
Very interesting.
Right, right. When I did my MBBS and MD in internal medicine in KEM, we saw that a fair bit. But it is a cause of a stroke in older people, as you very well know, have AFib just based on
And
age.
6% in the US will have AFib. In India, my guess is it's much more, but now with the watches and everything else, we're diagnosing it more readily. And people are potentially being treated with anticoagulation. And in that situation, you get a clot in the heart and that embolizes and goes to your brain, and that causes the ischemic entity. Um, what about what you eat, diet, obesity? Are those risk factors?
So obesity. The next one is absolutely obesity and sedentary lifestyle and a heavy alcohol use is a established risk factor. And then, of course, heavy drugs like cocaine and heroin are causes. Hypertension, high cholesterol, diabetes,
Yep.
and then irregular heartbeat, apart from being older. And then come lower on the list some rare problems like increased coagulation problems or something called vasculitis.
I know with heart disease, 4 to 10-fold higher risk if you have a first degree relative with heart disease. Same for stroke?
Yeah, it's similar. It's not one to one. It's not a direct, but certainly having a family history increases your risk of having a stroke. So you got to be even more careful.
Okay. So next we've talked about that, and now you've made your diagnosis with the BEFAST. What is the time window that we have to get in and do something about this? Because you know what people don't realize is a stroke is not forever if you diagnose it early enough and treat it. We're going to talk about the treatments in a second, but well, first of all, let's talk about treatments. And you're going to have treatments for ischemic strokes, which are due to poor blood flow from the blockages, and treatments for hemorrhagic strokes, which are different. And then more importantly, what is the time frame in the domestic setting, meaning in India, as well as globally, that you will accept? And I know there's two major treatments and then a third one, which you're offering now, which we'll get to. So let's talk about, first of all, what the treatment is for a ischemic stroke, which is poor blood flow.
The mainstay of immediate treatment in ischemic stroke is what is called a intravenous clot-busting medication, also known as TPA. And that is something that was approved way back in 1995. And it's now been around for almost 30 years. But the medication has to be given within 4.5 hours of symptoms starting.
Walk me through what should happen once you hit the hospital, and where should this be treated? Should you go to your doctor's office or should you go straight to a hospital?
So straight to the hospital. That's really key.
So you call 108 or 911 or whatever. This is a medical emergency, right?
Absolutely. It is. Every minute that the blood flow to the brain is stopped, you lose 2 million neurons.
Oh my goodness.
2 million precious neurons.
I didn't know that. That's amazing. 2 million neurons per minute.
Absolutely. And you will age within minutes from being a young, vibrant person to being much slower.
How many neurons do we have, just for reference?
It's about 200 billion.
Okay.
But you need every neuron, as you very well know, because it's such a precious a cell in the brain, and it's like losing parts of your motherboard of the computer. And the thing with emergency treatment with TPA is that a hospital, a stroke center, has the expertise to properly diagnose, do a CT scan 24/7 to make sure that there is no bleeding in the brain, because sometimes it can be a similar symptom from bleeding in the brain, with paralysis caused by bleeding rather than by a blockage. And once we rule out bleeding, we need to give TPA and now something called TNK through an IV drip in a controlled setting, in a monitored setting.
So tell
So if you
me,
go to a doctor,
what are the criteria for diagnosis? What things do you have to have in order to administer that? Because people are going to come back to us on the channel in the comments and say, Doc, we don't have all this stuff.
first and foremost thing is to suspect, the hospital that you reach has to suspect that you are having a stroke, which most hospitals should be able to do that. But then they need to calculate something called a National Institutes of Health stroke score. That is the common scale or the common language that all stroke doctors use to grade the severity of stroke. And so if your score is it's a score from 0 to 42, and if your score is 5 or more, you need TPA or TNK, which is the clot busting medication, right away.
And who needs to do that? Is it a neurologist or an ER or casualty doctor? Because I can tell you, getting some of these specialists into the hospital in the middle of the night is impossible, right?
The good news is anybody who's certified can do it.
Okay.
So it can really be, and this is an online certification. And so a paramedic, a nurse, a technician, as long as you're
We
certified
could work together with the government in
Yeah.
enhancing this and getting everyone qualified for this, for ACLS, for BCLS, because time is muscle, time is brain, right?
Right.
And
Absolutely.
getting expertise to assess and evaluate and treat is going to be critical. I love that. And
Absolutely.
so as I understand it, the kind of criteria, the gold standards are a clinical diagnosis, a CT making sure they don't have any type of bleeding in the brain,
Correct.
and then no other contraindications like a recent surgery or other reasons to having a
Bleeding.
thrombolytic or clot busting medication. And then you
Exactly.
administer the clot busting medication. What is the time window that you have for that?
Just 4.5 hours from symptom onset.
There's another treatment, and that's something which you're an expert in, and that's a thrombectomy. Tell us a little bit about that, and what's the time window for that?
Thrombectomy is really revolutionized our chances of reversing stroke in patients, ischemic stroke. And the good news is that the time window is much longer. It is 24 hours from
Wow.
symptom onset.
And typically, what does it cost to get that done?
Yeah. So it costs anywhere from about 3 lakh rupees to 8 lakh rupees, depending on where you go. But the good news is that Ayushman Bharat is now covering this for lower income level patients, which is almost 500 million
And
people.
when you look at the overall effect that a stroke has on an individual family as well as the country as a whole on the GDP, it's immense. I've seen figures which are staggering. So the 3 to 8 lakhs is a small drop in the bucket. It may seem like a lot initially, and particularly if Ayushman Bharat is covering it, that's powerful, right?
Absolutely.
And then the last thing which you've championed is injection of stem cells, and you've shown me some remarkable things, which will include. So I'm going to include the reference to the paper you published on the availability and prevalence of stroke centers and also embolectomy abilities. And then the second thing is, tell us a little bit about the stem cell interventions which you've been working on, and in a sentence or two, what is it that they do and how do they work?
Let me start by saying that stem cell therapy for stroke is still experimental, but highly promising. And this is the research that I've been doing for the last 18 years at the University of Miami in the lab and also in clinical trials in patients. And the reason is that stem cells are the building blocks of our body and also our repair cells. It's just that, and they are present more when we are younger, when we are kids, and then they slowly decrease, but they are still there in adults. They are actually quite a bit lower in brain as opposed to the skin, which repairs itself often as we see it. But the brain, the ability to repair is less because the stem cells are less. But with stem cell therapy, we give cells from the outside. And the approach that I've been pioneering is to give cells into the side of the stroke through the blood vessels with very dramatic results. And this can be given up to 48 hours
Oh my
after
goodness. So you do the
after
embolectomy, and do you
and
temporarily inject if they have some neurodeficits? Is that how you
yeah, so we are
decide?
typically giving it a day after a gap because if somebody improves dramatically after
And there's no
a
need.
ectomy, there's no need to give it. But if they
Okay.
still remain paralyzed after a few hours, that's when we give it. And we've seen that as long as we give it before 48 hours from symptom onset, in experimental approaches there is a very dramatic benefit. So just to quantify it, thrombectomy will result in 50% of people being independent or free of paralysis, significant paralysis. With stem cells, that this could be improved to 80 or 90% is what we believe from our experimental data.
And what is the number with TPA alone?
With TPA alone, it's only about 20 to 30%.
Oh my goodness. So these are still small. And that kind of bodes to the next thing, that what is the prognosis? Let's say you're diagnosed with this, you're treated with TPA. You're telling me that only 20 to 30% of the patients will go on to have no disability?
Correct.
And is that early or late?
We're talking about 3 months.
Okay.
At 3 months, they will be independent with a chance of 1 in 3 if they get TPA.
Okay. And with embolectomy, that goes to 50%.
Exactly.
And with embolectomy, and I'm assuming with the stem cells, it's not just an IV infusion. You're actually going in with a thrombectomy catheter or a guided approach and injecting into that basin where the stroke has occurred, right?
Exactly. Exactly. For a more targeted action of these stem cells. But again, that's really right now still to be proven definitively.
So depending on where it affected you, you could expect the deficits to improve for up to 6 months. Can it be longer than that?
It can be, but it slows down a lot after the first 3 months. The recovery slows down. Rehabilitation, therefore, is extremely important in the first 3 months, and then even up to 6 months, and sometimes up to a year, to maximize that recovery.
And
Uh,
so
so
even if we're talking about the 20 to 30% without disability, meaning 70% will have some disability, it may be minor, relatively speaking. But if you have no treatment whatsoever, you are left with whatever you're left with. And then it's a matter of overcoming that. And there is a huge amount of morbidity from strokes as well as mortality long term. Um,
right.
so last but not least, prevention. And we've talked a little bit about this: diabetes, metabolic syndrome, heart disease, alcohol and cigarette use. If you know you have risk factors for it, including familial risk factors, and you know you have the environmental risk factors, meaning the secondary things, people need to recognize that. And we'll put these all down as a listicle here and cut some reels from that so people recognize what the risk factors are to improve them. A lot of them are the same for cardiovascular disease, right?
Right.
Fortunately or unfortunately. It's just that stroke is one of those that it's can be one and done. But the problem is if you survive from it, which many people do, there's fates worse than death in that you're debilitated for whatever lifetime you have, and everyone around you is. What percentage of people die from strokes versus what percentage survive with debility or debilitating?
The mortality from stroke depends on the severity, and anywhere from 5 to 20% of strokes will die,
Okay.
depending on how severe it is. But almost anywhere from 30 to 50% will live with a lifelong disability.
My
And
goodness.
that's where, as you said, not only is the person devastated, but their family is devastated for anywhere from 5 to 10 to 20 years, as long as they survive.
That's amazing. And that too, in a patriarchal society, much of India, if you knock out the main breadwinner, it becomes catastrophic, let alone in the society as in general.
And as you said, the burden of a stroke is just massive. One of the estimates that we didn't get to is that 1% of India's GDP is affected every
Wow.
year from all cardiovascular and stroke that affects Indians. So this is something that we absolutely need to fight together. It's not a one man or one group show. It's really everyone needs to get involved. And I cannot tell you how fortunate I feel to join hands with you, and how fortunate I feel to call you my friend, to spread the message and to fight this together.
I'm looking forward to a bright future without strokes. I think just so people understand, this is millions upon millions, and it's increased almost tenfold in a span of 10 years as we go from an agrarian to industrialized society and have metabolic syndrome and have other challenges. And so I think there is a way forward, and hopefully this talk will galvanize some of what we need to do, and then others will step up and start to do this. But I'm looking forward to more such talks in this area and learning more from you. So thank you so much for joining me. And I look forward to helping others with this tremendous kind of problem which we're dealing with. And thank you for all your efforts.